Alright everybody, I know it's been a while since you've heard my voice, and the reason for that being is that I've wanted to do this video for a while now, but because it involves me talking a lot, and because my mic situation was dreadful before, a couple of days ago I received a new microphone. So besides me having a new mic and a crisp voice, this video is going to be a bit longer and a bit different compared to usual. The difference being it's not going to be directly about Muay Thai or MMA or whatever. It's going to be about the before and after of my hip joint. Yes, you've been staring at my hip joint. So if you've been following me for a while, you might know that I've actually had surgery on both my hips. One in 2020 and the last one in February of 2023. The reason for the surgery being a cam deformation of the femoral head, or a hip impingement, which in simple terms means that the femoral head, so the top of the leg, is too big for the socket. Now that doesn't mean it literally doesn't fit into the socket, because it very clearly does. To illustrate what I mean by it's too big, the area inside the dotted lines should be a lot bigger on the top, like on the bottom, as you can see, as I've also made the dotted line on the bottom. So the reason I had to have surgery is because every time I lifted my leg, my bone rubbed against the top of the socket, which you can probably imagine hurt quite a bit, and if left untreated can lead to having to have a hip replacement. Finally, onto the second slide. So they made 3 tiny fingernail sized incisions in my hip, one for the bone shaver and one for the camera. I don't actually know what the third one was for, and they shaved away a large amount of bone, as indicated by the red dotted line again. You can clearly see that there's a lot more room there now, so when I lift my leg up or kick someone, the bones don't bang on each other anymore, and thus resulting in a pain-free experience. It took me about 6 months to get back to fully training, and then another 3 months before I started a fight camp, which makes about 9 months total if my math is correct. Onto the left side, which is the more recent side. This time it's actually an MRI and not just an X-ray. As you can see, it's a similar situation as on the other side. Unfortunately, hip impingements are normally symmetrical, so if you've got it on one side, you've usually got it on the other side. So I always knew that the left side was going to come at some point. The doctor actually said that the left side was a lot worse than the right side, so he had to shave away a lot more of the bone than he did on the right side. If you wonder what the white colouring is on MRIs, that's actually liquid, so you can see that there was a lot of liquid around the joint at the time. What do I mean by liquid? Probably blood, because the bone kept banging at the top, which caused it, the tissue around it to bleed. And here's the picture after the surgery. As you can clearly see, there's a lot more space there again, so more room for the bone to move and less banging at the top. So if you've been listening carefully, you've heard that last time, so on the right side, it took me about 9 months to fully recover and begin fight prep. And I had this surgery on the left side in February, and it's now December, which, if you're in school for any length of time, means that you'll know that I've been working with this injury for 10 months. So why is it it's taken so much longer this time around than it did last time around? The surgeon's really happy with how it's turned out, even the labrum, etc., which I didn't even touch on in this video, because everyone's got goldfish attention spans these days. I left that bit out. So everything was healing well. I even started kicking again at about 5 months, and there's video footage of me doing it. So why am I still struggling, or struggling again? And it's actually because of the area in red. That's the socket where the femur is lying in, and it's not supposed to be that white colour. Now you might have noticed that all the white bits around the ball have vanished. That's because the ball isn't hitting on the socket anymore. But if you compare the ball to the socket, the shade of the bone on the ball is a lot darker than the colour of the shade of the socket. And in MRIs, bones are supposed to be more or less black, which you can actually see at the top of the hip bone and on the femur. So, it turns out I have a bone bruise of the socket part of the hip. Just for comparison, this is an MRI of my right hip after the surgery, and as you can tell, there's no white parts on the bone. It's basically pretty much all black. A tiny bit of liquid in the joint is good, but the bone should be black like on this image. And here's just a side by side, so you can definitely see the difference. So what that means is the current situation I'm in has absolutely nothing to do with the surgery. The surgery was absolutely successful, but what must have happened is I got swept in a sparring session at around 6 months. Got dropped on my hip and it got bruised. They basically work like regular bruises. If you push them and bug them, then they take forever to heal up. And if you just let them rest, then they go away. Maybe you can cool them a little bit, but there's really nothing you can do to make it go any faster except take vitamin D. Bone bruises can take anywhere from 6 weeks to 2 years to heal up. For me, it's already been 3 months approximately. It's gotten a lot better, but it's still not perfect, and I can't kick and I still can't run. And sometimes when I spar a bit more intensely or train a bit more intensely, even just boxing, I can still feel it the next day. So, positive news, surgery was successful. I most likely won't need a hip replacement anytime soon. Bad news is I'm going to be out for another little bit. So you're just going to have to deal with boxing videos, silly memes and motivational videos for the time being. So if you've got any questions at all, feel free to ask. If you're dealing with the same thing, feel free to ask. If you need tips on how to train around things like this, shoot me a message. And as always, take it easy.